Welcome to our medical histology lab on the endocrine system. Today we're going to explore the microscopic anatomy of the major endocrine glands and relate their structures to their hormone secreting functions. Endocrine tissues are unique because the cells release their products, hormones, directly into the bloodstream. So their histology is optimized for synthesis, storage, and secretion. As we go through the slides, pay close attention to the cytoplasmic staining, organization of cells into cords, clusters, and follicles, and the presence or absence of stored secretory material like colloid. We'll start with the pancreas, which is both an exocrine and endocrine organ. Most of the pancreas is made of exocrine acinar cells, but scattered throughout it are lighter staining clusters called islets of Langerhans, as seen on this slide. These endocrine islets release hormones like insulin and glucagon into the bloodstream, and the exocrine portion performs digestion, while the endocrine portion is regulating blood glucose. On histology, you can identify the pale islets surrounded by their darker acini, and that is key to identifying and distinguishing these two functional regions. The endocrine islets store their hormones in vesicles and release them via regulated exocytosis or myrocrine secretion. The main hormones here are insulin, secreted from beta cells, and glucagon, secreted from alpha cells. Insulin is going to lower blood glucose and glucagon will rise it. Each cell type has a slightly different staining pattern, but the general rule is that islets are paler and more vascular. We can see these capillaries here compared to the surrounding exocrine tissue. The islet's intimate association with capillaries allows for rapid hormone release into circulation. This diagram illustrates the location of the three major endocrine cell types in the pancreatic islet. The outer zone is called the mantle, and that contains alpha cells and delta cells. Delta cells secrete somatostatin, and that helps to regulate our alpha and beta cells. In the central core, you'll find more beta cells, which produce insulin. Recognizing this arrangement is clinically important because damage to beta cells happens in conditions like type 1 diabetes, and that can lead to insulin deficiency. Moving into our next portion of the endocrine system, we'll talk about the adrenal glands, which sit atop the kidneys. The adrenal has two major components, the cortex and medulla. The cortex itself is divided into three subcomponents, going from external to internal, the zona glomerulosa, the fasciculata, and the reticularis. And each of these areas produces a different class of hormones. The medulla itself produces catecholamines. The diagram here on the left and the corresponding histology is showing how the layered architecture reflects hormone functions. Identifying and understanding these zones is essential for recognizing adrenal tissue and correlating pathology with clinical symptoms like Cushing's or Addison's disease. Looking at our layers a little bit closer, the zona glomerulosa, located just beneath the capsule, produces mineralocorticoids like aldosterone. Beneath it, the zona fasciculata produces glucocorticoids such as cortisol, and the zona reticularis produces androgens. At the deepest level, the adrenal medulla secretes catecholamines like norepinephrine and epinephrine. The arrangement histologically shows we're going from superficial to deep in regards to organization. Zooming into the zona glomerulosa, the outermost cells are located just beneath the capsule, and they're organized into small ovoid clusters, which is why it's called glomerulosa, because it should remind you of the kidney glomerulus. They tend to stain more lightly, and they'll secrete aldosterone, which helps to regulate sodium and potassium balance. Histologically, this is the smallest of the three cortical layers, so identifying the capsule above and then this thin band of rounded clusters is a useful way to orient yourself. The zona fasciculata is much thicker and makes up roughly 80% of the cortex as a whole. These cells appear foamy or vacuolated due to lots of lipid droplets that are containing cholesterol precursors that help to create cortisol. On the image, you can see these, they're lined in more straight cords running parallel to one another. And this organized arrangement, along with the characteristic pale cytoplasm, is your best way to recognize and identify the fasciculata. These cells produce glucocorticoids, which are key to stress responses and metabolism control. The zona reticularis is the innermost cortical layer and has a darker, more eosinophilic appearance. And unlike the straight cords of the fasciculata, the cells here are more branching. They form more of a reticular network, hence its name. They produce androgens like DHEA, and the cytoplasm itself is denser. This distinguishes the layer from the fasciculata, and these cells can sometimes blend into the medulla layer below. The adrenal medulla below is composed of the chromaffin cells, which are modified sympathetic neurons that secrete epinephrine and norepinephrine as hormones. These cells stain more basophilically, hence their dark purple-blue color, and are arranged around large medullary veins. This is an important landmark because venous drainage is prominent in the medulla. These cells respond rapidly to stress stimuli, and on histology, the contrast between the medulla's loose basophilic pattern and the cortex's more organized structure can help distinguish the two. Moving into our next glands, we look at two closely related glands, the thyroid and parathyroid. Anatomically, they sit near each other, but their histology and their functions differ significantly. The thyroid uses a follicular structure to, as we can see here, to store hormones extracellularly, which is unique among endocrine glands. And the parathyroid, on the other hand, consists mainly of densely packed chief cells that regulate blood calcium. So we can look at each in more detail to understand these key differences. The thyroid gland has spherical follicles that are filled with colloid, and the follicular epithelial cells will line these follicles, seen around here, and they are secreting T3 and T4, active thyroid hormone. A unique feature of the thyroid hormones is that they're stored extracellularly in this colloid space, which no other endocrine organ does this. Parafollicular cells, as pointed out by this arrow, they're often called C cells. They secrete calcitonin, and they're located between follicles and they appear more pale. And when assessing for thyroid histology, we're looking for a variation in follicle cell height because if cells are hypoactive, they'll be shorter, and hyperactive, they'll be taller. Now, in between all these colloids cell and their cells, we can see our parathyroid glands, which is this dark staining purple structure here, and this is zoomed in on it, next to it on the right side. Our parathyroid glands contain mostly chief cells. These are small cells, they're dense, they have round nuclei, and they produce parathyroid hormone, which is the main regulator of serum calcium. In contrast to the structured follicles of the thyroid, the parathyroid has a compact cellular appearance. And with aging, you can see more oxyphile cells. These are larger eosinophilic cells that have more abundant mitochondria. Identifying the parathyroid often will depend on recognizing this dense area of cellularity and the presence of adipose tissue, as seen scattered kind of throughout. Moving up into the brain, we have our pineal and pituitary gland. These are closely associated with neuroendocrine function. The pineal gland secretes melatonin, and it's easily recognized by the presence of calcifications, which are sometimes called brain sand. And the pituitary gland, on its own, is divided into anterior portion and a posterior portion, and each of these portions has distinct cellular compositions and hormonal functions. These structures highlight the close connection between the nervous system and endocrine regulation. The pineal gland will regulate circadian rhythm and it secretes melatonin. Histologically, it has pinealocytes, which are cells that have irregular nuclei and characteristic calcified deposits known as corpora arenaceae or brain sand. And we can kind of see these little dots within these cell types surrounding this region. So we can see kind of these little speckled dots of calcifications. And these calcifications will increase with age and make the pineal gland easier to identify. The gland itself develops from the diencephalon, which explains its kind of central location to the brain. And when scanning tissue, look for the combination of pinealocytes and these dark basophilic calcifications. And that's what these little speckles are. So this is the pineal gland surrounding a basophilic space. This slide will introduce our pituitary gland, and the anterior pituitary is here, the adenohypophysis. This is epithelial in origin and contains endocrine cells that produce several trophic hormones. The posterior pituitary, or neurohypophysis, contains axons and glial cells because it's essentially an extension of the hypothalamus. The pars intermediaire separates the two locations and sometimes can contain some colloid-filled cysts. So this is posterior, and this is anterior, and this is the pars. Posterior, anterior, and the pars. Understanding these regions helps you interpret these next slides where we're going to look more closely at distinct cell populations. So in the anterior pituitary, we can break down our cells based off of their appearance under stain into chromophobes, which stain pretty much clear or faint, acidophils, which stain more eosinophilically, and basophils, which stain more basophilically and or darker. So we can kind of distinguish our cells based off of that. All of the cells here store hormones in secretory vesicles and are arranged in cords, and they are surrounding these capillaries. As we can see here, all this red is capillaries. Unlike the thyroid, there is no organizational pattern by cell type, and different hormone producing cells are all intermixed and mingled. We can break down our cells in the anterior pituitary, like I said, based on how they stain. So our acidophils contain our somatotrophs, which produce growth hormone, and our mammatrophs, which produce prolactin. And our basophils include our gonadotrophs, which secrete follicle stimulating hormone and luteinizing hormone, our thyrotropes, which secrete TSH or thyroid stimulating hormone, and our corticotrophs, which secrete ACTH or adrenocorticotropic hormone. Recognizing these patterns can help identify these cells on high magnification. But again, these cells are all intermixed and mingled in the anterior pituitary. In our posterior pituitary or our neurohypophysis, it contains not as many cells. It's containing more non-myelinated or unmyelinated axons that start from the hypothalamic neurons, the neurons in the hypothalamus. And these axons terminate near capillaries in the posterior pituitary, and they'll release antidiuretic hormone or ADH and oxytocin. The expanded axon terminals, which are hard to see in this image, but that's what the herring bodies are referring to. That's where the neurosecretions are stored. And these cellular elements here, if you do see a cell or a nucleus, they're mostly pituocytes, which are supporting glial cells. Compared to the anterior pituitary, the posterior lobe is much less cellular and much more fibrous. So that's how you could compare and contrast when looking at the two tissues. Overall, this is our mini rundown of the endocrine histology. Think about the key identifying features of each gland, the foamy cells of the zona fasciculata, the colloid-filled follicles of the thyroid, the mixed chromophil populations of the anterior pituitary, and understanding these structures will help you diagnose endocrine disorders and interpret pathology.